Good afternoon. Welcome to a show which I call A Crohn's Disease Life. It's hosted by me, Michael Weiss. It's a show about chronic illness and Crohn's disease, which I have suffered from for 25 years. But it's a show where I try to tackle reality with respect to healthcare. And it's been building up a nice audience, and I am very thankful of that. Well, today's show is entitled the BP oil situation and the health insurance industry. It may seem like a strange combination, and maybe some people will say that I'm trying to exploit a very tragic situation for my own purpose, I guess, of bringing attention to Crohn's disease or a book that I wrote, but that's not the case. The reason why I connect these two is because it's tragic to see obviously 11 people lost their life, and our environment is going to be devastated for many, many years, and my heart bleeds for the people in the Gulf Coast and elsewhere. There's no qualifying statement to that. That's just a fact. However, I will say that when I saw, and I'm looking down at notes, that the Mineral Management Service, which is, I guess, the agency that was negotiating with all the oil companies over the years, that Elizabeth Birnbaum resigned yesterday. She was apparently basically in charge of it. It sounds like she was fired. But the reasons that she was fired scared me. And it scared me pertaining to health insurance. And here's why. Apparently, oil is such a necessity that I would imagine that when these folks go to the government, they sort of get what they want. They're taking all the risk. It's a business, and it's a very, very difficult job. But there needs to be a separation. There needs to be some Chinese walls where our government sets regulations, but that's not what was happening. And I don't want to go all Geraldo on you here, although if I had the resources, I'd love to do an investigative report. But it looks like people from MMS, the Mineral Management Service Agency, was socializing, fraternizing, having sex, getting gifts, doing drugs with oil industry executives. Now, look, that's like in Casablanca when he says, "I'm shocked that there's gambling going on in this establishment." For two reasons. One is because that's reality, and two, the oil industry, there are people who work in it for 50 years, and people stay in it, they develop relationships, they grow up with people, and some people end up on one side, some people end up on the other side, and they do each other favors. So it happens. But I'm glad that this has been revealed because the recent healthcare reform was a great step, but the pharmaceutical industries and the health insurance companies had to be dealt with first. And President Obama, even though he's not a big fan of lobbyists, and I applaud all of his efforts thus far, they cut deals. They cut deals with health insurance companies and pharmaceutical companies, and the problem is that very much like BP drilling 5,000 feet under the ocean without a contingency plan, I'm really afraid of that with health insurance. It sounds like we did what we had to do to get healthcare reform, and we didn't want to scare the health insurance companies too much or the pharmaceutical companies too much. But the reality is that there needs to be someone looking into the practices of these companies. Because, for example, health insurance companies now, when you try to enroll and fill out an application, the questions they ask are so intense. List every medication you've taken for the past 10 years. List every symptom, everything. If you make a minor mistake, years later, they could negate coverage because of some innocuous mistake. They just have too much power. We need to regulate them better. And I don't understand why President Obama and the government didn't do this. And I look at the BP oil crisis as a horrible, terrible, tragic result of what could happen when one hand doesn't know what the other hand is doing, when the government isn't regulating things. Think about it. We are relying upon a corporation, BP Oil, to save the environment. Let's be serious. Corporations make money. That's what they do. They're cold and calculating. Health insurance companies are the same way, except they're providing health care. They are making life and death decisions. My question is, are we regulating them the way we should? Or are we fraternizing with them a little bit too much. And I really hope that this BP oil situation, obviously I hope it gets fixed, but I hope it does open up people's eyes, and there are investigations made into the relationships between Congress people and lobbyists and pharmaceutical companies and health insurance companies. Because healthcare reform is great, and I'm glad President Obama got it done, but he had to cut some deals. And you'd be a fool to think that the health insurance companies and the pharmaceutical companies weren't the first people that he had to appease, because I'm sure they were shaking in their boots that someone was going to try to take their money away. So I don't want to get political. I'm not a political person, but I'm scared. As a chronically ill patient, when we give health insurance companies and the pharmaceutical companies too much power, we're going to have a situation that's analogous to what's going on right now in the Gulf. And I don't mean to minimize it at all, because it's a catastrophe of enormous proportion that's going to affect many generations. But health insurance can do the same thing too. So think about it. I guess some may say, well, who am I? And, well, I wrote a book about my Crohn's disease and my approach. It's called Confessions of a Professional Hospital Patient. So as a professional hospital patient, I've had about 100 to 150 hospitalizations over 25 years. So I've seen every different form of healthcare insurance model that we've had over the years. So I've been following it closely, and I'm scared. So, but the book is entertaining, it's funny, it's informative, whether you have Crohn's disease, colitis, or chronic illness, or a friend of yours does. You'll learn a lot about the illness, you'll laugh, you'll gain some perspective. You can check it out at Amazon.com, BarnesandNoble.com, or on my website at hospitalpatient.com. You can contact me always at Twitter. Hospital Patient is my address, or leave me a comment on the YouTube channel, or my email address, michaelweiss at hospitalpatient.com, and I would love to tackle any issues you want me to talk about. Have a very nice and safe Memorial Day weekend, and let's hope that this crisis in the Gulf gets resolved as quickly as possible. Thank you.